bringing together voices in child and youth healthcare. This is CAFC Presents.
CAFC would like to thank the following member organizations for their generous support of our knowledge translation activities: the IWK Health Centre, the Children's Health Foundation of London, the McMaster Children's Hospital Foundation, the Children's Hospital of Eastern Ontario, and the Children's Hospital Foundation of Manitoba. We would also like to thank the following Keystone partners for their ongoing contributions that support all of CAFC's programs and activities. Hello, everyone, and welcome to today's episode of CAFC Presents. My name is Doug Maynard, and I'm the Associate Director at CAFC, the Canadian Association of Pediatric Health Centres. And with that out of the way, we'll get on with the session. Today's webinar is titled Ensuring First Nations Children Equitable Services Through Jordan's Principle. And we're very excited to bring this topic back to the CAFC Present stage, which, as some of you may recall, this started back in 2013 with where Dr. Wanda Sinha and Dr. Lucyna Lach brought this topic, introduced us to this topic and the research study that they were initiating. And that research team was led by our two researchers from McGill. That team eventually included members from University of Michigan and University of Manitoba, and included a very strong partnership with a number of organizations that included the Assembly of First Nations, UNICEF Canada, the Canadian Pediatric Society, and CAFC was also honored to be a part of that group as well. The report just released last week received a solid response from the media, with many of the research team being called upon for comment and interviews. So we're very excited to bring this information relatively hot off the press and to welcome Dr. Sinha and Dr. Lach back to the CAFC Present stage. Wanda Sinha is an assistant professor in the School of Social Work at McGill University. Her collaborative research focuses on understanding the ways in which social policies facilitate or impede the efforts of marginalized communities to support and care for children. Much of her research focuses on First Nations child welfare and on service disparities for First Nations children. And Dr. Lucyna Lach is an associate professor in the School of Social Work at McGill and is an associate member of the Departments of Pediatrics and Neurology, Neurosurgery in the Faculty of Medicine at McGill. She has a special interest in health-related quality of life and parenting of children with chronic health conditions and disabilities. And you may recall Dr. Lach from previous appearances on the CAFC Present stage with the CIHR team in Parenting Matters and presenting some of their work along with Peter Rosenbaum. And if you were at our conference in Calgary, she also joined Dr. Rosenbaum and brought that CAFC Presents, the Parenting Matters research to the joint session with the Canadian Network for Child and Youth Rehab and CFAN, the Canadian Family Advisory Network. So if any of you were at that session, you would also recognize Dr. Lach's name. So once again, as I mentioned, it's my pleasure to welcome these two great researchers back to our stage. So I'll hand the virtual podium over to you, Dr. Sinha.
Hello, this is Vandana. It's my pleasure to be here, and I'd just really like to start off by thanking CAFC for the opportunity to present this and for their participation in the research that we are going to be presenting today. Lucy's here with me, and I'll let her say hello herself.
Yeah, hi everybody. I'm really excited to bring these research findings back to the community. That's what it's all about. While we're presenting the results of what we found, really want you to try to listen within your practiced ears, because we're doing this and presenting this because we want you to be able to reflect on what the meaning and the significance is for you as a practitioner in the setting that you're in, for you in the discipline that you represent, as well as for you personally. And we'll be inviting those kinds of reflections, certainly invite them throughout the presentation, but also want to be able to leave some room at the end for some discussion about that, because ultimately these kinds of seminars are about informing your practice.
So we've prepared this little presentation that to walk you through the findings from the report that Doug mentioned. And at the heart of this research and at the heart of Jordan's Principle is the tragic story of one boy and his family, which then leads to a discussion about lots of other children and their families. So Jordan River Anderson was born in the Cree Nation of Norway House in Manitoba, and he was born with complex medical needs and was needed to be in hospital for the first 2 years of his life. But his hospital team approved his release from hospital when he was 2 and found at that time that the best thing for him would be to be in a specialized care home closer to his community, closer to the family that loved him and wanted him close at hand. And what happened after that determination was made was that the province and the federal government started to disagree about who should bear the costs for his care outside of hospital. And they disagreed about, fairly expensive things, and frankly, they disagreed about fairly inexpensive things too, because at the core of that was not a discussion about a little boy and about the best interest for him, but a discussion over fiscal responsibility and setting precedent in other cases.
Right. So that principle, the idea of the best interest of the child, is a theme that you'll hear throughout this presentation, because ultimately, the upholding the best interest of the child is a value, is an ethical principle that permeates many of the health disciplines. But what you were referring to earlier was interesting. So there was disagreement about who was going to pay for what. So is that's what's called jurisdictional?
Yeah. So jurisdictional dispute, in simplest terms, is when there's disagreement about who should pay for services and how much should be covered in order to meet the standards of health services and social services that have been laid out in legislation and in practice standards. In Jordan's case, the dispute was between the province and the government. And the federal government. I'm going to talk more about that in a minute. But in his case, those disputes went on so long that he actually passed away in the hospital, never having spent a day in a family home, and never having had a chance to experience a life outside of a hospital setting and with a family and with a community that desperately wanted him back. First Nations children are extremely susceptible to jurisdictional disputes because of the complex structure of services for First Nations children. So while health services, for instance, are primarily a provincial or territorial responsibility, for non-Aboriginal children, for First Nations children, you have this intersection of federal, provincial, territorial, and First Nations responsibility, and it's not always at all clear who should be paying for things, how much should be paid. There's a lot of kind of gray area and messiness.
So that's part of what makes it more complicated, the sort of the moving of children, of a child, I should say, from the reserve to the hospital and back, or from the reserve or even off reserve to a rehab site and back. There are decisions that need to be made about how that child is going to get there, what kind of supports that child needs. Once they get to their destination, how the family can be supported. And so it's not just a provincial, it doesn't come out of the pocket of the province. Is that what you're saying?
Even when there's not movement of the family involved, so off reserve when it comes to First Nations children, just if we stick to the health domain, you have First Nations and Inuit health benefits, which are federally offered, and then you have provincial supports that ought to be available to off-reserve families. And we find situations where the federal government is saying, oh, well, it's not our responsibility, we're the payer of last resort, and the province is saying, oh, well, that's a First Nations child, that should be a federal responsibility, and the child and the family get caught in between.
Right.
We also find situations where the things that are covered under federal benefits may not meet the same standards and of care and the same kind of level of care that's mandated and that's supported by the province.
Right, right.
So all of those kinds of situations fall into what we're talking about when we talk about jurisdictional disputes, and in our work we find evidence that those occur between federal and provincial territorial governments, between First Nations governments and federal governments, and also that they occur between departments of the same government, so between Aboriginal and Northern Development Affairs in Northern Development Canada and First Nations Inuit Health Branch, for example.
Right.
So, building on the kind of tragedy that unfolded in Jordan's case, his family and his community and First Nations advocates really wanted to ensure that that didn't happen to other children. And so they devised Jordan's principle, named after Jordan River Anderson, which is a fairly straightforward idea. And you can see that I put a description of the principle up there on the slides, but the idea in simplest terms is just this. If there's a jurisdictional dispute around services for a First Nations child, whichever agency or department they contact for services should just go ahead and pay for the services that would be ordinarily available to other children, and they can work out these questions about who really has responsibility afterwards.
So that's the child first principle.
Yeah, we put the child's best interest first.
Right.
And we put the wrangling about money and jurisdictional responsibility afterwards.
So that's the main principle. What's interesting to me about this is how such a situation, an unfortunate and tragic situation with Jordan, how that process actually, or that experience became a piece of a principle. Was it a private member's bill that?
Yeah, so it was the campaign for Jordan's principle was really led first by Jordan's family and his community, and then with support from First Nations organizations. They brought it forward with Gene Crowder's help as a motion in the House of Commons in 2007. It received unanimous support. So every member of the House of Commons stood up and said, this is a good idea. We ought to be doing this.
Yeah, how could you disagree with it?
And since that time, almost 9,000 individuals and organizations have signed on as supporters of the principle. At a website run by the Caring Society, you can see the URL up there in the right corner. If people are interested in signing on themselves. So there's been really a lot of support for the principle. Which, when you hear about the tragedy in Jordan's case, when you think about the difficulty of a family trying to access services for a child and getting caught up just because they're First Nations and people saying, oh no, it's not our fault, it just makes sense. So moving forward, then what happened in response to that House of Commons motion that passed in 2007? Well, starting in 2008, the federal government led development of a response. So they really embarked on this process to set forth a series of policies to determine, well, how do we identify a Jordan's principle case and how do we deal with one once it's been identified? They have formal agreements with 4 provinces, and they've stated numerous times that other provinces and territories have processes in place.
Sorry, what was that?
They've stated numerous times that other provinces and territories have processes in place for dealing with these Jordan's principle cases.
Okay, so how do you what if one is recognized as such?
Yeah.
There needs to be some kind of administrative mechanism to move it forward and resolve it.
To identify these cases and to move them forward. And so, since that time, since 2008, the federal government has been representing the situation as being addressed. We've put these processes in place. We have these agreements. At the same time, they've said multiple times now that there are no known Jordan's principle cases in Canada.
And that was really what prompted this whole process of this research that we did together along with others, is this statement that the federal government was making that there are no Jordan's principle cases in Canada on the one hand, and then on the other hand, there was an experience on the ground, if you will, by First Nations healthcare providers and families that actually, that maybe wasn't so much the case.
Exactly. And so we just wanted to understand, how do we make sense of the disconnect here?
Right.
The anecdotal evidence of Jordan's principle cases was pretty strong. A group of us meeting at an Assembly of First Nations gathering, we're just, talking about, well, how is this going? And it seemed to all of us that we could identify situations that ought to be Jordan's principle cases. And still the federal government was saying, well, we've put things in place so we can deal with Jordan's principle cases, but there just aren't any out there. At the same time, there were groups that were documenting pretty serious concerns over the scope of the governmental response, and you can see some quotes from different groups that are up there on the screen. It's just a small sample, and there were calls for implementation of Jordan's principle that were coming out from multiple pretty high-profile groups concerned about children's rights as well. And so when we put that together, people are calling for implementation of something, but the government says it's already done that. People say that they think they see these cases, but the government says it doesn't know of any. We wanted to understand, well, what on earth could be going on there?
Why this disconnect in messaging? I mean, I think it's really the Canadian Council of Child and Youth Advocates, the Canadian Pediatrics Society, UNICEF, and the Assembly of First Nations are all strong advocacy groups and that represent children's voices, and we're calling for some kind of recognition of this issue. I think is put that way.
Yeah, and so we set off on this quest to figure out, well, when the federal government says, well, there are processes in place, what does that process look like? Say I'm a parent and I need services for my child, and I'm being told that I can't have a service that I know is available to a non-First Nations child, that might be available to a child who lives, just a few miles away off reserve. Well, what happens when I'm in that situation? How does that work?
Can we maybe walk through this with an example of something that a particular formula, let's say?
So I'll give a few examples that came up in our interviews with health and social service providers. So a child needs access to a drug that's approved, that's on
drug formulary, yes.
On a formulary that's covered, say, for low-income families by the province. A low-income family on reserve is not able to access that same drug because it's not approved for coverage by the federal government. A family living on reserve needs access to respite care or physiotherapy services,
or early intervention services,
diagnostic services that are typically available off reserve, and they can't get them on reserve, and they can't get payment for the transport to access them off reserve. Another example, and I'm thinking of one that's from a specific province. In that province, children off reserve are entitled to multiple mobility assistance devices so that their needs are met. On reserve, children are entitled to one mobility assistant device every 5 years and don't get the same support for installation that they would get off reserve.
Right.
So these are kind of well-documented examples that we can find. We find them in reports commissioned by governments. We find them in reports for governments. We find them in places where both provincial and federal governments have signed off on them. We know that they exist.
We haven't made these up, in other words.
Exactly.
Either read about them in some report or received information about them.
Right, or the health and social service providers that we talk to flag them for our attention. We track them down in policy documents to verify that they were true. There's widespread documentation of underfunding of services for First Nations children. So these kind of underlying issues that we would expect could give rise to situations in which children are being denied equitable services, they're known. It's not a secret. So we're starting with examples like that. So a First Nations child needs services that other children are entitled to, but neither government will pay. And the first thing that happens is a kind of case conferencing, the government says, at the local level. So your service. Okay,
wait a second. Hold on a second. So they already have to know that the government won't pay?
Well, it's going to manifest itself based on a number of things. So the family somehow has to have a sense that they're entitled to a service.
Right.
They need to have figured that out on their own. Or for the service provider to have said, well,
you need this, but
that I can't give it to you because it's not covered for First Nations people. So let's say that's knowledge is there. They're asking for the service, or the service provider is wanting to offer it to them, and they're not able to access it, right? So there hasn't been a formal declaration from the governments that they won't pay, but there's a block at that initial level. A child needs a service. It would ordinarily be available to others. They're being told, no, you can't have that.
Okay.
And then there's a process that we don't know much about that would happen at the level of the local service provider. So your physician or whoever you're working with at a hospital,
A discharge planner, let's say.
would try to sort that out using the best of their resources, the best of their knowledge, working with the confines of their probably heavy caseload, all of that. They would kind of make the best of it. And the federal government has been really clear in saying that's how most cases should be dealt with, and they ought to be resolved at that stage. And there's no time limit on that. And we have really no way of counting how many cases emerge at that.
Well, I think in some of the interviews that we did in this project, that we certainly, I interviewed providers or healthcare providers across the country, and their stories did emerge about, we get creative. If we know the child needs this and it's not on the formulary or it's not in the list of non-insured health benefits, then we'll contact some kind of a community organization that might be able to pay for it. And so there's a lot of that kind of advocacy and support that happens at by providers at the local level.
And also a lot of ingenuity in terms of working things.
Completely.
The example that always sticks out for me is the one around medical transportation. You have a child who needs services who don't rise to the level, a non-reserved child that don't rise to the level that the federal government will pay for their transportation to get to those services. And so you wait until a more serious issue emerges, you get funds for transportation for that, and then you schedule all the other kinds of services and appointments that they need around that.
That didn't meet the threshold before.
Yeah, so you get the kid there, and then you try and line everything up so that they can get all those other needs attended to. And there's lots of little tricks like that surfaced in talking to people. And so that's, it's extremely important that people are willing to bend the rules in that way, really attest to the care and the commitment of service providers.
Absolutely. So that's the resolution reached through case conferencing at the local level.
Exactly. Okay. They find some way to work it out. If they don't find some way to work it out, then it might be that everything just ends there. A family is already trying to care for their child. They have a lot to deal with. They may just say, well, we're going to just go home and make do with what we have. If they decide to pursue it further, then there are a couple questions that are going to be asked. Does the case involve a jurisdictional dispute between the provincial and federal government?
Now that part's really key, isn't it? And as we've learned, that the dispute has to be between one level of government and another level of government.
There's really limited research on the prevalence of jurisdictional disputes, but the research that there is suggests that disputes between departments of the federal government might actually be more common. So we're ruling out a bunch of cases there. The next question, does the First Nations child live on reserve? And if not, then it doesn't go forward. So we're ruling out a bunch of cases there.
Which cases? So we're ruling out the First Nations children that are off reserve.
Yeah,
okay.
Who are getting caught in these disputes that have to do with
whether the province is going to pay for it, right? Or whether, because they are First Nations, whether the federal government should pay for it. Okay.
And then a third question, and this is one that even takes a while to get out, have they been assessed and have they been found to have multiple disabilities requiring services from multiple providers? Right?
So that was not in the original Jordan's principle, is that right?
No, that does describe Jordan's situation, but it's fairly clear that in creating this principle in his memory and in his name, his family and his community and the First Nations advocates who have done that work, we're not hoping just to help kids who who fit into that narrow category.
That's interesting. And then what constitutes a multiple disability? I mean, I can think of children that have, that I used to work with who have intractable epilepsy, let's say. And intractable epilepsy or intractable seizures can be quite incapacitating. I don't think that the epilepsy community thinks of it as a disability, quite honestly. So even though that child may, there may be a dispute, for example, about something that child needs, whether it's access to surgery or access to some kind of intervention, other kind of intervention, I don't know. But I'm not sure that child would be considered as having multiple disabilities.
Right, so there are definitional questions that really complicate that. And there's an ethical question, too, which is, we as a society, I don't think that we've just made a commitment to provide equitable services to children who have multiple disabilities requiring services from multiple providers. We've made a commitment, through the terms of the Constitution Act, through the terms of international agreements around human rights that we've signed, we've made a commitment to provide equitable services to all children. But the way that Jordan's principle is being implemented right now doesn't fit with that, right? So, a case comes up, you make it past the case conferencing level at the local level, a solution isn't found, then you answer these questions. If it's not an intergovernmental dispute, if you're not living on reserve, if you don't fit into this category of having been assessed, which means you're able to access diagnostic services. If you're not, you're really in a triple bind, right?
Oh, yes.
And you have multiple disabilities, however that's defined, then you can move forward. If you say no to any of those questions, then this governmental response to Jordan's principle is not for you. If you move forward, then the thing that happens is that you get referred to a focal point.
And what's a focal point?
It's a strange word, isn't it? A focal point is someone appointed by a federal, provincial, or territorial government to help facilitate Jordan's principle cases. And the thing about focal points is that they're not very easy to find.
Well, we had a hard time finding them, didn't we? Like we thought, geez, this is really interesting. I've never heard, and certainly I had never heard of them before. And as we began to search for them, we had some pretty bizarre experiences.
Yeah, we had a research assistant spend a couple of days following the information that's available on government websites and called around, and once in a while, she got to a person very easily who said, oh, yes, I know what Jordan's principle is, and I can help you. But more commonly, she had to explain to the person on the phone what Jordan's principle was. She had to explain to them what a focal point was. And then she'd be transferred to someone else who maybe could help her, or maybe she would have to explain again and be transferred again. And you can imagine that for a family that's trying to get services for a child in need, it's just not a fair burden to place.
Right. So that's the point here, is that we work in the business, and this is something, we're relatively well connected, and we're having trouble finding this person. Imagine what it would have been like for the family themselves.
Yeah. But let's imagine that that's done. Okay, you connect to a focal point. I'm moving on to the next slide. And then what happens is that the focal point has to receive some paperwork. And they have to receive actually quite a bit of paperwork. They need an assessment from a health or social service professional. They need information on the current proposed service plans. They need a report of the issue and the reason for the referral to focal point. They need a summary of the steps that were taken to resolve the issue. And once they have all of that, they need to initiate a second case conferencing process, and that has to happen within 10 days of receiving that information.
That should be kind of interesting. I don't know whether this is going to be possible, Doug. It would be to ask the audience whether they've ever heard of a focal point.
Yeah, we can certainly ask the audience that, and if anyone has heard of a focal point, please just type it into the question box. Just to let us know if this is a term that you're familiar with, or if you've ever interacted with someone who represents this position.
Yeah, thank you.
So the focal point then initiates this case conferencing process, which they have then 45 work days to resolve. So you can see the time adding up, right? There's the case conferencing process. You have to make your way to the focal point. You have to provide all the paperwork. Then there are 10 work days before the case conferencing process has to start. There are 45 work days to resolve. And it's the focal point that actually makes the decision here, that that gathers information and decides, well, is this child being denied services?
Meanwhile, the child remains where they are, suspended without access, without access. Is that really so? So this is another issue with the process.
It's a process that
10 days plus 45 days. That's 55 days.
That's 55 work days.
Oh, geez. Okay.
Plus the time to gather the documentation, plus whatever time it took at the case conferencing process. We have, through documents that the federal government compiled about cases that they labeled Jordan's principal-related cases, we have stories that include situations in which a child who needed a special bed in order to be able to breathe properly waited months. So it's not a fast process. It's one that institutionalizes delays.
So that's kind of ironic, isn't it? This is the process that's supposed to ensure that the child gets the services that and yet it is perpetuating the very same thing.
Ironic is the kindest word I can find for it. So 45 days, hopefully things get resolved there. If they're not resolved there, then an assistant deputy minister in one department decides that we should declare a jurisdictional dispute, and they write to the assistant deputy minister in the other government, who then has to respond in writing saying, oh yeah, I agree, there's a jurisdictional dispute here. And if that doesn't happen, then that doesn't happen. And there's no appeal process. And if it does happen, once two assistant deputy ministers have exchanged communication around this and agree in writing that there's a jurisdictional dispute, then the costs of services will be covered for a child.
Oh, okay. So up until that point, the child does not receive it. Okay.
Which, I mean, when you understand the kind of complexity of this process, the delays that are involved, the stresses that it would impose on the family, it doesn't make it surprising then that the government is able to say that there are no Jordan's principal cases in Canada.
And what's really, I think, important to point out here is that this whole process moving forward is very much a function of the family being aware, or healthcare providers being aware that this process exists, and ensuring that it moves through the way it's supposed to move through.
It's a function of the family being aware, first of all, that they ought to be entitled to something else, which is a high burden to place on a family. Mm-hmm. Number two, being willing to pursue this process while also caring for their child. Absolutely. Number three, being able to stick it out through
and not
all
give
of
up.
The yeah. And number four, as we've seen in a recent case in Nova Scotia, governments may well decide that there isn't a jurisdictional dispute, that it's just a situation in which a First Nations child is receiving a lesser quality of services, but they're not fighting about it.
So they both agree that there is a problem.
They both agree on the level of services that are being provided, and we find places where that's clearly written. I'm thinking of a Manitoba report that's signed off on by both the federal and provincial government representatives that lays out these kind of disparities and gaps in services. Yes, we recognize that the level of services being provided to First Nations children are less, and here are some examples, but those don't involve a jurisdictional dispute because we're not fighting overpayment right now. Right. So that's not a Jordan's principle case.
So we agree that there is no dispute, there is no disagreement. So this can therefore keep going the way it is.
Yeah,
we acknowledge that this is the state of affairs.
The burden of transforming an acknowledged service gap or service disparity into a jurisdictional dispute in a Jordan's principle case, that burden falls squarely on the back of a family that has a child in need. Right. So what we get then is a complicated story, right? So a jurisdictional dispute occurs over services for a First Nations child, and when we say jurisdictional dispute, we're thinking of a situation in which a child is being denied equal services or equitable services because they're First Nations. And then two things can happen. One, they can decide to pursue Jordan's principle designation, and as we've just discussed, they go through this 8-step process to declare a Jordan's principle case, and it's a process which systematically narrows the cases eligible for child first protections and which institutionalizes service delays. And at each stage of that 8-step process then, cases are ruled out and removed from that Jordan's principle process, and they flow back to the other stream. The other stream is that a jurisdictional dispute occurs over services for a First Nations child. A Jordan's principle designation is not pursued, and the child receives a lower quality of services, and we've talked about some of the examples there. And then a couple of things can happen. One, their condition can deteriorate, and they can qualify for an increased intensity intervention at a later stage. So rather than diagnosing, I'll just use an extreme example that came up in the interviews, rather than early diagnosis of cancer, we would wait and we would treat that at a later stage, right? And then you can think about all kinds of, increased deteriorating conditions that result from not having early access.
Right, so there's a huge emphasis on early intervention as an example, that early intervention in the case of cerebral palsy or in the case of kids diagnosed with developmental issues. There is a dearth of early intervention services on reserve, and certainly access to early intervention services that require occupational therapists, physiotherapists, or just early interventionists is almost non-existent. So as a result of not having access to those kinds of supports, you can imagine that a child who needs physio to keep their mobility up will then require a higher level of, and presumably also more costly care at some point in the future.
Yeah, and one of the things that came up again and again in the interviews was this kind of link between the lower quality of services and an increased risk of institutional care, right? So of being hospitalized, of being placed in out-of-home care through the child welfare system, of being placed in some other kind of institutional setting in order for a child to have their needs met.
And that in and of itself there's a whole history there, right?
I mean, that in and of itself is wrong on a clinical level, right? Not what we would say is in the best interest of the child in any context. And in the historical context of a Canadian history in which the federal government and provincial governments have been complicit, have systematically removed First Nations children from their home, first through the residential school system and then through the 60 Scoops, through the child welfare system. It's deeply problematic.
Yeah.
So, increased intensity intervention. The other thing that we heard a lot about were these kind of extraordinary efforts that families and communities and service providers are making to ensure that children do receive services. Things like family relocation.
We heard a lot about family relocation, about families being split up or moving lock, stock, and barrel to be closer to where their child may be able to receive intervention on an ongoing basis. But the result of that for them around the social isolation, these families being uprooted from everything that they know culturally from the extended family has tremendous impact.
And then also sometimes getting caught in extra-jurisdictional disputes around supports for low-income families. When you have a family who's ordinarily resident on reserve, but temporarily living off reserve because of a relocation issue related to services, there do seem to be situations in which they then don't qualify for provincial supports around housing and income supports and things like that. Right. So we find examples of that, examples of out-of-pocket payment, examples of fundraising efforts by communities.
And certainly there was, the social workers and the discharge planners had, they many of them have relationships established with the organizations that they typically go to get those, to ask for funds to buy things like, deodorant and shampoo and to pay for, some of the, it's costly. I don't know, it's costly to have a child that is in a rehab setting or in a hospital setting, and to be living outside of that setting. I don't know that anybody's ever done any kind of a cost analysis on that, but it sure would be interesting to know what that looks like.
Yeah, so we heard about fundraising for things like that, but we also, for instance, found through the tribunal an example of a community that did fundraising for a wheelchair for a child in care, because they had been rejected through NIB, and the appeal process is quite complicated and lengthy, right? So there's a mix of things happening there. And we also find cases of service providers, calling a drug company, for example, and negotiating a humanitarian discount, which, again, speaks extremely highly of the service provider, but is not a reasonable way for us as a society and for a healthcare system to deal with the needs of vulnerable children.
Absolutely.
So then the question is, well, here's this thing that's been implemented that governments are claiming is Jordan's principle, but it doesn't have a lot of bearing with the original vision. How do we reclaim that original vision? And the original vision would then be that fairly straightforward. There's a jurisdictional dispute. The service is provided by the Department of First Contact, and the payment dispute is settled afterwards. In addition, there's systematic efforts to remedy the underfunding and the jurisdictional ambiguities that caused the jurisdictional dispute in the first place, so that you prevent future cases involving the same jurisdictional dispute. And the end result would be something really simple. We have this graphic from AFN that I've clipped from, where they, a child would request health services that were ordinarily available to other children, and they would get them. And that's all that would be visible to the family.
Right.
So how do we get there? The first thing that we need to do is we need to go back to the original vision of who and what kinds of cases should be covered under Jordan's principle. And I'm going to walk through these 3 points one by one. So the first, we need to start identifying cases based on the existence of jurisdictional ambiguity or underfunding. That's in contrast to the current response. The current governmental response requires formal recognition from two governments of a jurisdictional dispute. It creates a situation in which a recognized service gap or disparity doesn't necessarily translate into a Jordan's principle case.
Can you just clarify what you mean by a service gap or disparity?
Yeah, so a service gap would be a situation in which a First Nations child requires a service that's ordinarily available to other children, and that service just doesn't exist.
Okay.
A disparity would be they require that service and it exists, but it's provided at a lower level. It's provided by a nurse instead of a doctor. It's provided in an institutional setting rather than in home or in community, things like that. Right? And there was a recent case, I mentioned it before, in Nova Scotia, involving Jordan's principle, and the ruling in that case was quite strong, and it really highlights the potential for what I would call collusion between governments in these cases. Situations where governments decide together, well, the child is just allowed this level of services, and because they're not in dispute over what should be provided, then that's not a Jordan's principle.
There's no problem.
Exactly. Yeah. And that's what happened in the Pictou Landing case. You have a quote from the ruling in that case there. It really focuses on the possibility that governments could agree on a position that just wasn't true,
or tenable,
and that would make the case go away.
Right.
So that doesn't seem to us like a reasonable way to identify Jordan's principle.
And what happened in that case?
In that case, because there's no appeal mechanism included in the Jordan's principle process, the mother and the band council demonstrated exceptional strength and pursued a court case. It took multiple years. There was an appeal filed by the government, which they dropped at the last moment. And last update I had, the band council that had been covering services for the child in question still hadn't been repaid, but it's been a few months since I checked it.
Okay.
So instead of this, what we think needs to happen is we need to look for jurisdictional ambiguities, those situations in which there's a lack of clarity over responsibility for services, funding or provision, and where that lack of clarity has the potential to result in denial, delay, or disruption of service.
So you're talking about ambiguity, jurisdictional ambiguity, as opposed to what were you calling it before, jurisdictional dispute?
Yeah, a formally declared jurisdictional dispute. Like, we shouldn't wait for governments to say, oh yeah, we disagree. The second that there's some question about who should pay, and it seems that a child is falling in the gaps. And we have lots of examples of that. For instance, a status-eligible child, a child who is eligible for registration as a First Nations status person, but hasn't completed that paperwork. And we find situations where the federal government will say, oh, well, they're not registered, and the province will say, oh, but they can be registered, and there's a lack of clarity there. That's a situation that should be flagged from day one as a Jordan's Principle case. And the other thing that we should be looking for is underfunding. We should be looking for any situation in which the resources provided by one government or department are insufficient to allow another government or department to live up to normative practice and legislative standards. And the second that we spot a case like that, that should be flagged as a Jordan's Principle case. 2, Jordan's Principle must apply to all status and status-eligible children. We already talked about the restrictions on the current governmental response. Only children ordinarily resident on reserve with multiple disabilities requiring services from multiple service providers. Those restrictions have to be removed. Number 3, Jordan's Principle must apply to all inter- and intra-governmental disputes. So again, we've talked about this a bit, but the current governmental response is limited to disputes between provincial and territorial and federal governments. That excludes disputes between 2 government departments. It excludes disputes between First Nations governments and the federal government, and both types of cases are known to occur. So if we bring those 3 things together, then we have the foundation for a true human rights principle that's not just honoring a small subsection of children and ensuring their rights, but really is applying to all First Nations children and systematically addressing the extra challenges that they face in accessing services because they're First Nations. So then that leads us to some questions about process. What do we need to do to really reclaim Jordan's Principle in process terms? Well, number 1, First Nations have to be included as true partners in the development and implementation of this principle, and that hasn't happened.
What do you mean?
Well, we have situations in which there have been bipartite agreements, so an agreement between the federal government and the provincial government signed around Jordan's Principle, and First Nations haven't been included. We even have some situations where a tripartite process was underway and a bipartite agreement was reached. We clear that the AFN, the Assembly of First Nations, requested multiple times to be involved in the designation and the training of focal points, and they've been refused that right. So this is a principle that's named after a First Nations child. It's been advocated for by First Nations people, and they have to be involved in developing and implementing the response. Number 2, Jordan's Principle must operate as a true child-first principle. We cannot institutionalize the kinds of delays that are involved in the process that we walked through. Number 3, there have to be consistent standards for repaying the cost of services provided during a Jordan's Principle process. We cannot expect health care organizations or social service organizations to cover the cost for a service for a child if they don't have reason to believe that they'll be repaid. And right now, in the PIC2 landing case, it became quite clear that the federal government is not ready to ensure repayment to First Nations. And there was a fund of $11 million set aside to cover Jordan's principal cases. That fund was returned to the Treasury on the argument that there are no Jordan's principal cases in Canada. So it's not even clear how those costs would be repaid. Number 3, measures of transparency and accountability have to be incorporated at the case level. People have to know how to find a focal point, who that focal point is, how the process will work, and what they can do if they don't agree with the decision. There has to be an appeal mechanism.
For those who are listening, where would they find a focal point?
Right now, the only thing that they can do is to call a regional ANSI or FNIB office. If you Google focal point, you'll get an Aboriginal Affairs and Northern Development Canada web page that lists the contact information for those offices, and then you probably will have to explain to them what Jordan's principle is and what a focal point is, and follow that train through.
Okay.
I am going the wrong direction, sorry. And the last is that there have to be measures of transparency and accountability at the policy or the program level. It was incredibly hard for us to figure out how this process works.
Oh my goodness, boy, was it ever.
It's really been treated as an internal government secret process. There hasn't been any evaluation. There's no independent oversight. And that has to change too. There are kind of clear standards in lots of human rights work for the way to go about ensuring people's rights, and where we are right now, it doesn't meet those standards. So our partners in this work, the Assembly of First Nations, the Canadian Pediatrics Society, and UNICEF Canada are co-authors in the work. CAFC has supported the work throughout as well. These groups have called on the federal, provincial, and territorial governments to work with First Nations without delay to do 2 things. 1, develop and implement a governmental response that's consistent with the vision advanced by First Nations and unanimously endorsed by the House of Commons. And 2, to implement mechanisms for systematically identifying and addressing the jurisdictional ambiguities and underfunding that give rise to each Jordan's principal case. So it's not enough to wait for a family to bring these cases forward and say, well, we'll deal with those in a true child-first fashion. That under Canadian and international law and agreements and under treaty agreements, the governments also then have a responsibility to fix the problems so that it doesn't happen to other children.
Now, we've produced this report and made these recommendations together with our partners. What's happened since?
The federal government has issued a statement assuring everyone that processes are in place, that agreements have been signed with 4 provinces, and that there are currently no jurisdictional disputes involving Jordan's principle in Canada. So there we are. It hurts me a bit to say that at the end of this presentation, but we'll keep kind of plugging away at it, and we hope that others will too.
It's not the end.
No,
not the end. This is a journey, and we're really interested in hearing from the audience about, actually kind of reflecting as I invited you to do at the very beginning on ways in which you can, now that you've heard the story, move this agenda forward.
Right. And so the first question for everyone to think about is, do you interact with First Nations children who are on or off reserve? And if the answer to that question is yes, then Jordan's principle should be something that that applies to your work. And then we have a set of questions that we pose to people to think about after, but also to write in about right now.
So right now there's a poll that's in progress for those who are attending to respond to the question, do you interact with First Nations children who are on or off reserve? And there's 3 options. I regularly interact with First Nations children. I regularly are on reserve, off reserve, and I rarely or never work with these children. So just to ground the response, Doug's got the poll open. Doug, do you want us to wait for the response?
Yeah, so I just wanted to mention to the audience that this, you can select more than one. So you can select both that you interact with First Nations children both on and off reserve. This is sort of a select all that apply. if you wanted to go and amend your answer further before we close this poll off.
So while those poll responses are coming in, I'll just pose the other questions, and you can respond to these either by writing text in and sending it in the question space right now, and then we hope that people will keep discussing them and thinking about them afterwards. And we want people to really think about, well, what are the ways in which you could raise awareness of or incorporate Jordan's principle in your practice setting? So how can you connect Jordan's principle and the story and the struggles that we just talked about in your workplace? To what are the ways in which you could raise awareness of Jordan's principle within your discipline? So beyond your everyday workplace in the larger kind of professional milieu that you're in. And third, are there ways in which you could raise awareness of Jordan's principle in your personal life? And all three of these questions seem to us to be really pivotal to move from a state in which the federal government feels comfortable saying, oh, well, Jordan's principle, we did that, and there are no cases, to one in which they really are forced to face up to what's in place right now and grapple with the ethical and financial implications of really providing equitable services for First Nations children.
Doug, do you have the results of the poll?
Yeah, we do. So most of the, based on the nature of the presentation today, we do see that 65% of the audience regularly interacts with First Nations children on reserve, almost half with children off reserve, and only about 35%, about a third, rarely or never work with First Nations children at all.
There was also the question that we had about what the proportion of the audience that might be familiar with a focal point. Is there any way of gauging that?
Yeah, so we did not have anyone respond that they had heard of a focal point. The best we could do was a colleague in Edmonton said she had heard of a contact being available, but had no idea how to access that person, who it is, or what program or ministry that person would be with. And we also had a comment from Saskatchewan that said they've heard of the principle, Jordan's principle for sure, but have no idea where they would take a concern or a referral if one arose, and asking the question back to us, do they even have a focal point there in Saskatchewan? So.
There is a focal point in Saskatchewan. I don't have the contact information here with me, but again, if you call your regional office for ANSI or FNIB, and the contact information for those offices is easy to access, then the instructions from the federal government right now are that that's what you should do. You should call the regional office and you should ask to talk to a focal point. And I think it would be great if everybody would just find some time in the next week to do that. You don't have to have a case in mind. Just say, I work with First Nations children on a regular basis. I know about Jordan's principle, and I want to make sure that I can get in touch with someone if a case arises. Because the thing that happens right now is that they've made it so difficult to enter this process and get any information about it in any way, that there's a kind of reinforcing feedback loop that happens there. Nobody calls because they don't know how to call. Right. And that enables them to say, well, nobody's calling, so it's not a problem.
It's a self-perpetuating cycle. So I guess I'm wondering if there are any comments from the audience about what has this invoked or provoked in you as a provider to do differently as a result of knowing what you have heard here today. Certainly, I remember I was a practitioner many years ago, and certainly these kinds of focal points weren't around then. But knowing now what I know, I would definitely be practicing differently. As we make recommendations for physio, for OT, for nursing, there are individuals that are located in rehab and hospital settings that have developed an expertise in connecting with communities where children are going back to, so certainly first of all ensuring that the resources that are being recommended, or that the kind of supports that are being recommended for families exist. And if they don't exist, is that okay? And can it rather than being rendered invisible, can it be rendered visible in some way? And I know that these are day-to-day difficult kinds of issues that people experience. So I think that making this into a phenomenon, making it visible within your setting, within your discipline, within your personal life, is tremendously important to putting the issue on the table as opposed to keeping it in the closet.
So we did have a couple of comments and questions coming in, or more questions related to what we presented as opposed to comments here. So we'll give people some more time to sort of think about the questions that are up on the screen and maybe provide some comments and input. But you mentioned, Wanda, that the response from the federal government was that there are 4 provinces that they've signed agreements with. Katie's asking just if you can tell her what 4 provinces have the signed agreements.
Sure, they're British Columbia, Manitoba, Saskatchewan, and New Brunswick. Nova Scotia has an agreement that exists just with Mi'kmaq Child and Family Services. And the line from the federal government is that all the other provinces or territories have responded that they have processes in place and they don't need an agreement. Our best understanding is that First Nations themselves were never consulted about whether that was true, which presumably would be a good place to start.
The next question came in. Brenda was asking, would Jordan's principle apply for children getting appropriate educational supports? So, for example, children who are blind or partially sighted.
Very good question.
And it's an issue that came up. The disparity in educational services supports came up quite a bit in our interviews as well. And the answer, like everything else having to do with Jordan's principle, is it depends on who you ask. In the original vision of Jordan's principle and the vision that was endorsed by the House of Commons, yes, Jordan's principle isn't just about health services. It's about services and about equitable services, and that's a vision that's consistent with Canadian law and with international agreements around human rights, and so it should apply.
And it's also reflected in the suggestions and recommendations that we've made as a group together with our partners.
Right, but we do see, for instance, in the Human Rights Tribunal hearing around inequitable funding for child welfare services on reserve, we see that the federal government has argued that Jordan's principle doesn't apply to child welfare.
Actually, maybe you could say a little bit about the human rights, the tribunal that.
Yeah. So if people haven't been following this case, that may in part be because it's taken so very long to make its way through the system. In 2007, the Assembly of First Nations and the First Nations Child and Family Caring Society filed a human rights grievance charging that the systematic underfunding of child welfare services on reserve, in combination with the government's inequitable approach to implementing child welfare services, constitutes racial discrimination because it systematically discriminates against on-reserve First Nations children. And that case didn't manage to make it into the human rights hearing process until, I believe, 2013. The federal government really tried to have it dismissed on administrative grounds. But it finally made its way in. It's been heard. It wrapped up in October of last year, and a decision in that case should be released soon, by the end of April at the latest. And one of the things that's under consideration in that case is Jordan's principle. The applicants, so the Caring Society and the Assembly of First Nations, have asked that the tribunal mandate the full implementation of Jordan's principle and oversee that implementation process.
So we're really hopeful that some of the findings there, and certainly our recommendations, will inform that decision or that process.
Yeah, and that the decision will, kind of breathe new life into revisiting the response that's in place and reshaping it. I think, though, that it's really important that service providers and service organizations be prepared for that shift to take place, right? So part of what has to happen is on the governmental level, there has to be a removal of these restrictions and a reworking of the process so that it's a true child-first human rights principle. But once that's in place, and maybe even before, service providers have to know what Jordan's principle is. They have to know how they can figure out if they're dealing with a jurisdictional dispute
or ambiguity.
Yeah, they need to know, who to contact, and they need to be prepared to think of that as part of their responsibility,
as opposed to it depending solely on the family moving it forward.
So we do have a question about just around some clarity around this jurisdictional dispute, and this question is coming from Saskatchewan. So maybe even an example from Saskatchewan would help. But they're saying they're confused about who or what is the actual provincial level for children on reserve. So when we talk about the provincial level, she's asking, is it their band? They understand that FNIB would be the federal government, but what exactly is the provincial level? So maybe if you could use an example of what a dispute might look like, giving specific ministries or departments within Saskatchewan, if you had an example like that.
Okay, so the question is really, really important because you see right away how many cases are ruled out from the current governmental response, because there isn't a provincial involvement in most cases in reserve communities, right? There's the federal government and the First Nations. And there could be a provincial provision of child welfare services, for instance, through a ministry, might serve on reserve. They would be getting funding from the federal government, but they would be providing those services. So there are some cases in which a province could be directly involved in the provision of services on reserve.
Or if a child was living off reserve, then the child would have access to the kinds of services that the province offers.
Yeah,
to all children.
But they would be, but then there could be, for instance, a dispute between FNIB and the province. But on reserve, you could have a situation where the federal government was providing where the provincial government was providing services, but more often you would have a First Nations providing services or the federal government providing services, and then you would have the situation where you have a dispute between a First Nations provider or between federal government departments, but you have a kind of indirect involvement of the province in a way, which is that provinces and territories are responsible for setting the standards of care in most health and social service domains. So you have one entity that's saying, well, this is what we ought to be providing to children. You have the federal government that's then funding those services. You may have a First Nations agency that's providing the services, right? And then you have kind of all the messiness that evolves when you're trying to work between those different entities. And I'm going to revert to a child welfare example for a second because it's a domain that I know better personally. But I just lost my train of thought.
It would have been a child welfare example.
So for example,
province.
Yeah. So for example, all provinces and territories have pretty strong language around the necessity of prevention services and support services. Pretty strong, kind of practice standards around trying to support families to stay together when it doesn't pose danger to the health and safety of the child. And until 2007, there was no federal funding for prevention and support services and child welfare. In a few jurisdictions, there's still no federal funding for prevention or support services, and by the federal government's own assessment and evaluation, the provinces that do get some federal funding for prevention and support services and child welfare on reserve aren't getting a level of funding that's comparable to off reserve, right? So you have agencies then that are caught in the middle between provincial standards and federal funding levels, and they become the mediators of this dispute. So that's a little bit complicated, but I hope it's clear.
Yeah, well, as clear as it can be, I suppose, considering the complicated nature of this topic. We did have another question come in from Saskatchewan, and they're asking, how could Jordan's principle be applied regarding children receiving respite services on reserve? He says, off reserve in Saskatchewan, there is respite provided to children with cognitive disabilities through the provincial government, but she's not aware of on reserve status of that.
Exactly the example that we were looking for to clarify the complicated answer that I gave to the last question, right? This is a case in which the province has established standards for care off reserve and funds services that are in accordance with those standards. On reserve, the federal government is not funding services that are in accordance with those standards.
And so oftentimes the family is bearing the brunt of that, or the band council is, or the reserve is paying, they're paying for it themselves. But in fact, isn't that what happened in the Pictou-Landing? If anybody wants to read the ruling, it's Pictou-Landing, Pictou Landing case, was precisely about this.
Right, and so it's a jurisdictional dispute. It's a dispute that involves underfunding, as we define it, a situation in which the federal government is not providing enough funds to enable the provision of respite services in keeping with the provincial standards. And that ought to be a Jordan's principle case, but most definitely wouldn't be recognized as one under the current governmental response.
Because it's not between the province, because
the province is invisible there.
That's right. That's right.
Because the province is the invisible player, and because First Nations aren't explicitly acknowledged anywhere in this conversation.
Right. Yeah.
All right. Well, we are sort of running out of comments from the audience, so perhaps we can maybe start thinking about some closing comments. We are almost out of time for this session, so maybe we could think about some closing comments from our presenters.
Yeah, so I'm just going to go back to the implications piece around this. I would really, really encourage those who attended and heard to go back to their in their practice settings and seek out material. Certainly going on to the First Nations Caring Society's website, there's information there about Jordan's principle. We have this full report of the working group available, so you can refer. There's a ton of references there if you want to inform yourself further about some of the case studies that we've referred to. Our quest and our invitation to you is to make this visible.
Right. And we started to, another colleague and I started to think about some ways in which that could happen, and just even simple ways. If all health service organizations would include somewhere on their webpage just a link to Jordan's principle, just a mention of it. If everybody who's listening to this webinar would go back and take that step of calling and figuring out who a focal point is, and letting people know about that. If people want to go to the Caring Society's webpage and sign up as supporters, if you are part of some kind of a professional society or a collective and you can introduce discussion about Jordan's principle into policy statements, there are lots and lots of ways in which we can start kind of building awareness of the principle. And what I think is that once people understand, well, what the principle really is, and understand, well, what's the scope of things that ought to be covered under this, you'll start to see them a lot. That's certainly been our impression in talking to people.
Well, just like the question about respite was perfect. I mean, it was something that you probably have stumbled on, over and over and over again, and not realizing the connection to Jordan's principle.
Yeah, the same with kind of different drugs being covered in formularies is one that's come up a lot when I've presented to medical groups.
Early intervention services for kids on reserve.
Diagnostic services.
Absolutely.
So that the examples are there, and it's a question of getting people to recognize them and then to build a voice that counters the kind of consistent statement that's coming out of the federal government in particular right now that, oh, well, Jordan's principle is a done deal. We got that. And there's just nothing going on. So in closing, I really wanted to take a minute to thank all the organizations and individuals who have been involved in doing the work that we presented on today. It's really the result of a multi-year project undertaken by a fantastic group of people. And I put their names up there. And then I just wanted to say that if you have any questions or comments, things you'd like to know about, don't hesitate to email me, and I can pass questions on to Lucy as well.
Sure.
We'd love to hear from you.
Thank you.
Oh, well, thank you. It was a fantastic presentation, a very complicated topic, as we can see, but certainly one that certainly generates a lot of interest and a lot of questions. We did have a last-minute comment, our colleagues in Saskatchewan sort of responding to the questions about what could they do, and they said perhaps it just starts with something as simple as making a handout telling people exactly what the principle is and who and finding out who that local contact is, that focal point is, and getting that contact information out and available to everyone, just as a starting point.
That's a great idea, and there's a nice handout on the Caring Society's webpage, jordansprinciple.ca. There's a 2-page brief on our webpage at the Child Welfare Research Portal that covers the report findings. So those might be places to start.
Yeah. All right. Well, thank you very much.
Suggestions. Thank you. And you're right. So it is sometimes a simple gesture like that to increase awareness. That has potential, even a poster. Are you aware of, do you know anything about Jordan's principle? See, blah, blah, blah.
Yeah, it sort of reminds me of some of the hand washing campaigns around for reducing infection control, where I think it was in Manitoba, they wore buttons that said, it doesn't hurt to ask. It doesn't hurt to ask your healthcare practitioner to wash your hands. It could be something similar. It doesn't hurt to ask if you are concerned or have a question that perhaps you are not being provided a service that you think you should be. Just ask the question.
Exactly.
Yeah. And Lucy and Nanda, it's Elaine. I just wanted to say thank you for just a fantastic presentation, as Doug had said. And I think, maybe one of the first things, your suggestion along the simple things can make a difference. We would certainly be willing and should. I mean, we're one of the organizations back in 2007 that endorsed the principle, but we should certainly put that link up on our website.
Thank you.
Maybe others will follow that suggestion as well.
Perfect. Thank you very, very much.
Yeah. So we will we'll try to get all of those links that you were referring to the First Nations Child and Family Caring Society, to the links to the report are already up on the page on the Knowledge Exchange Network, et cetera. So we'll try and get as much of that information up there so people can find it easily. And that's also the page where the recording will go. There was also some of this conversation certainly is reminiscent of a few weeks ago when we had José Lavoie, Dr. José Lavoie from University of Manitoba and Dr. Pat Blakely from Saskatoon talking about service disparities for First Nations children. Dr. Lavoie is part of this working group, but they talked a lot about some very specific, Dr. Blakely provided some very specific case studies and examples of some of these service disparities as they happen in Saskatchewan. So, and really talking about the processes and the advocacy that goes behind that the practitioners had to engage in to get access to these services in the absence of clear processes. So that's certainly something you may want to check out if you're interested in this topic about service disparities for First Nations children or Jordan's Principle. There is the previous recording that our today's presenters, Dr. Sinha and Dr. Lach, presented a number of years ago, back in 2013, as well as the more recent one from Dr. Lavoie and Blakely. So lots of information on the Knowledge Exchange Network if you do have an interest in learning a little bit more about this. So thanks once again to our presenters. Fantastic presentation. And as always, thanks to our audience. It's always great to have everyone here. We do have our webinars every Wednesday at 11 a.m. Eastern Time. And it is great if you can watch live, as the questions and the comments really enrich and inform the discussion as we go along. But if you can't watch live, as I mentioned, we do record these sessions and make them available on the Knowledge Exchange Network. We've got a great lineup coming up for the next few weeks. We've got next week, we've got Dr. Chris Weckerell, Chris Musquash, and Abby Goldstein talking about caregiving and resilience, supporting youth in adversity, in transition, and in community. Following that, we have Jeanette McDougall and Patricia Baldwin talking about quality of life for youth with chronic health conditions and learning from youth's and parents' perspectives, and presenting some of the results from a recent report that they published. And on March 11th, it's our pleasure to welcome back our colleagues from the CYCC network. That's the Children and Youth in Challenging Contexts network, to talk about supportive environments for youth with complex needs. So some great stuff coming up in the next few weeks. Thanks for joining us today, and hopefully we'll see you back here next week. All right, bye, everyone.